Roundworms. At least 1 billion people are infected with some species of roundworms, also known as nematodes. They make up the phylum Nematoda and are one of the most plentiful animals on Earth. Most are so small that they are invisible to the naked eye, but they are everywhere. Different species have different adaptations for living in the human body. Some live in the intestine, some in the blood and the lymph, and some in skeletal muscle. Different species of roundworms need different intermediate hosts as well. Whipworm, or Trichinosis trichiura, is an intestinal nematode. Its life cycle starts with eggs in human feces entering the soil. The eggs develop in the soil and are ingested with food that has not been thoroughly washed or with unclean hands. Inside the human intestine, they develop into adult worms and burrow into the villi of the small intestine, where they produce eggs. If untreated, intestinal nematode infections can cause chronic diarrhea, damage to the intestines, decreased absorption of nutrients, and long-term malnutrition. These conditions may cause children to develop slowly and to have learning difficulties. Some roundworms may invade other organs as well, affecting lungs and liver and causing more advanced disease. And here is a nice reference on this topic. To avoid infection from parasitic nematodes such as whipworm, wash leaves and vegetables thoroughly before eating them. Keep all human feces away from farmed soil to break the cycle of infection. Use other sources of fertilizer. Wash hands frequently. Whipworm infection can be passed from person to person by hand-to-hand contact. Hookworm disease is also called trichinosis, caused by the roundworm Trichinella spiralis. Like whipworm, hookworms are nematodes. They have part of their life cycle in the soil. Many infections occur when people walk barefoot in contaminated soil. Hookworm is a major cause of illness in some countries and has negative impacts on the growth and development of infected children. The early symptoms of hookworm infections are a rash, such as shown here and here, pain, fatigue, nausea, poor appetite, and diarrhea. If untreated, chronic hookworm infections lead to anemia from blood loss and malnutrition from lack of protein. Symptoms vary from person to person. Early symptoms can include nausea, diarrhea, vomiting, and abdominal pain 1 to 2 days after eating undercooked meat. 2 to 8 weeks after infection, symptoms advance to muscle pain, fever, swelling of the face, fatigue, headache, and changes in bowel habits. Rarely, the infection moves to the heart muscle or diaphragm, causing heart and breathing problems. Some people clear the infection without ever being treated or diagnosed, and many people have no symptoms at all. Hookworms enter humans from the soil through cuts and scrapes or hair follicles of the skin. They migrate through the blood to the lungs. Then coughing into the mouth, followed by swallowing, transfers the worms from the lungs to the intestines. Adult worms attach to the villi of the small intestine and eat the lining, ruining the absorptive surface of the intestines. There they produce eggs that are released in feces to begin the life cycle again. Here's a diagram. We have the larva entering the bloodstream. Perhaps you stepped on something and you had an open cut. Travels up the bloodstream. It then circulates through the heart and lungs. If a person coughs, the larvae are coughed up into the mouth, and then the person swallows, and now it enters the digestive system, where eventually it passes into the small intestine, and it lives harmoniously. Harmonious for the hookworm, not for the human being. Elephantiasis, or lymphatic filariasis, is caused by the roundworm W. bancrofti. Mosquito bites transfer the larva of W. bancrofti from one person to another. The larvae enter the lymphatic system. They mature and cause blockages in lymphatic vessels that prevent drainage of fluids from the limbs. The result is elephantiasis. It can cause extreme swelling of the lower limbs and fever, and possibly the thickening and hardening of the skin, making it harder to walk. Since 2012, 17 countries have eliminated elephantiasis through the distribution of the drug albendazole. Malawi is the second country in sub-Saharan Africa to eliminate the disease, yet it remains in 73 other countries. Loiasis is caused by loa loa, a roundworm that infects fatty tissues of humans. It is transmitted to humans by bites from infected deer flies and horseflies, which live in muddy areas and near wood fires, and tend to be active during the day. The adult lower roundworms usually reside under the skin in fatty tissues, yet they can be seen in the eye when the temperature is warm. Right over here. That's not very good looking, is it? Infections may be treated with the drug DEC, yet advanced infections may spread throughout the body and be more difficult to treat. Expert advice is needed for advanced cases. Threadworms, also known as pinworms, are caused by the nematode Enterobius vermicularis. They are probably the most common parasitic infection in the world, especially in young children. Threadworms are thin, white roundworms that are visible to the naked eye and look like white threads. These worms live in the large intestine and anus and usually cause no symptoms, but may cause anal itchiness. The worms may be transmitted when eggs on the skin around the anus are moved to the mouth of another person by hand-to-hand contact. Threadworms are treatable with parenteral pomoate.